Doctors have seen an uptick in injuries resulting from self-workouts. Now, that comes as self-workouts like online yoga sessions and running see sustained popularity even as COVID-19 restrictions ease, thanks to their flexibility and convenience. But how can we tell if we're taking exercise too far? Well, for more, we're joined by Dr. Derrick Oh from Island Orthopaedics. Good evening, Dr. Oh. So we hear that you've seen a significant proportion of people with these knee issues among the cases of self-workout injuries. Can you explain why and how severe are these cases typically?
Okay, part of the problem happens when patients squat poorly. So executing a good squat is more like a sitting down procedure where the butt sticks out and the knee stays back. Whereas if you squat badly and the knee comes forward, it's more like a kneeling down procedure. So that's an example of a good squat where you keep the weight back. That reduces the amount of stress going through the meniscus. So in the model here, you can see that if you squat with a lot of flexion and the weight going through it, the force is exerted on the back of the meniscus, and that concentrates the force and helps to and will then damage the meniscus. The meniscus plays an important role in the knee. It helps to prevent cartilage degeneration. So when the meniscus gets torn with any kind of high pressure situation, especially with any kind of twisting, that will cause damage.
So, Dr. Oh, what are other certain sort of exercises that can be commonly associated with injuries that you've been seeing?
Right now, a lot of people are running. So especially if they're running on hard surfaces like the road, then there's a lot more impact going through to the ankles, the joints, the knees, and that can result in damage. Any kind of workouts that are unsupervised, like yoga sessions, especially since the YouTubes don't come with any kind of warning labels as to the difficulty level. If you participate in these activities without proper instruction, without proper warm-up, it's likely to get injured. So even simple things like forward flexion, like the model is showing right now, if you don't do it with the muscles warmed up, you do it too quickly, you might tear something or strain something. So generally, when we do stretching, it needs to be a slow, sustained maneuver. You cannot rush it because you're more likely to tear something. If you maintain the force gently and over a certain period of time, the fibers actually stretch and align themselves in the direction of pull, and you get a better stretch with less force and less likelihood of injury.
So with that, you mentioned earlier, Dr. O, about the squats. I mean, doing squats wrongly, but not doing this forward fold properly, as an example. How bad can it get, though, if people were to sort of be doing these self-workouts at home repeatedly? And what does repeatedly mean? I mean, are we talking about over days, over weeks? How bad can it get, the damage?
Okay. The main thing with squatting is that it's not just the exercise itself. If you are squatting at the bus stop, waiting for the bus, squatting while you eat durians, that kind of squatting while you're cleaning under the bed, that's going to cause more damage to your knees. And what usually happens is that the patient tries to write it off, tries to compensate by using the other knee more. Then that loads the good knee and causes more problems for the good side. Studies have shown that a meniscus tear can result in more than 250% increase in the force experienced by the cartilage, which is trying to protect. So when that happens, it will then cause more problems to the other side, and then you end up with two bad knees rather than just one.
Yes, so I do appreciate a deep squat when you're talking about a durian squat. I know this exactly the squat you're talking about. Well, if you talk about minor injuries, though, and if they're left untreated, complications can arise. What would you recommend for people that want to exercise on their own and, take advantage of online classes in terms of sort of monitoring form?
Okay, a little bit of common sense. So if something hurts and it's very bad, if there are any mechanical symptoms, if the joint feels loose, it feels unstable, if there's any kind of swelling, if the joint feels a lot warmer than the other side, it's probably time to take a step back, take a rest, and maybe consult someone who knows what's happening and take a look at the injury for you. Otherwise, if it goes away very quickly, it's a vague kind of pain, it's more like an ache, there are no mechanical symptoms, you can probably just ice it, take a rest, and see how it feels. But anything more than that should probably be looked at, just in case.
So important to get form right and for function to be right. Dr. Oh, thank you very much for sharing that important information with us. We've been speaking there to Dr. Derrick Oh from Island Orthopaedics.